Hello, everyone. Good morning, good afternoon, and good evening to our audience joining us from different time zones. I'm Divya Prajapati from Tata Elixir, and I'm thrilled to welcome you all to the webinar on simplifying care delivery through Gen AI powered digital health platforms. Before we begin, a few housekeeping notes. So we will have Q&A. So feel free to send in your questions at any time using the Q&A widget in the BrightTalk platform. This session is also being recorded, and you will receive a link to the recording in a few days, which you can share it with your families and friends. So let me provide you a brief overview of Tata Elixir. We are the design and engineering arm of the $150 billion Tata Group, recognized for our commitment to innovation and excellence. We are a trusted growth partner for leading medical devices and pharmaceutical companies worldwide. In today's webinar, we will explore how digital health platforms can leverage Gen AI applications to transform care delivery in the medtech industry. Now, our discussion will focus on monetization strategies, interoperability, and leveraging data driven insights to drive innovation and improve patient outcomes. So, to guide us through these exciting use cases and the impactful advancement Gen AI is making in healthcare, we have an exceptional panel of speakers joining us today. So, first, we have Dr. Ami Bhatt, Chief Innovation Officer at the American College of Cardiology. Her extensive experience and passion for innovation make her an excellent host for today's conversation. Joining Ami is Atul Singh, General Manager of Digital Health at LG Electronics, and Ajay Satyanarayan, Practice Head of Digital Health at Tata Elixir. Their expertise and insights will enrich our discussion and shed light on the practical applications of Gen AI in healthcare. So, without further ado, I'm pleased to hand the floor to our esteemed panel host, Dr. Ami Bhatt. Ami, thank you for joining us. Over to you.
Great. Thank you so much for having me. And good morning, good afternoon, good evening to everybody. I just want to start by commenting on how impactful it is right now that we have Tata Elixir with us, we have LG, and then we have the American College of Cardiology. This was not a common occurrence 10 years ago, where these three industries that largely would work somewhat siloed would come together and recognize that in order to be successful at delivering digital health, at delivering health to the communities where people live, and doing it in an effective way that improves outcomes but is also cost effective, we would really need these three different industries to come together. So it's an honor to be here and to be hosting along with my two colleagues today. As we think about generative AI, I just want to put it in a little bit of perspective. We recognize that much of healthcare is changing thanks to artificial intelligence. We also recognize that machine learning has perhaps been the most powerful mechanism of AI that has been with us in healthcare for many years. However, with the recent advent of generative AI that can really be used by almost every company to some extent to be able to improve healthcare, this we thought was our opportunity to show you how our companies think about the use of generative AI, think a little bit about what regulation we need to help develop to make sure we do this safely, and most important, really think about how to streamline care delivery to really improve patient outcomes. So with that in mind, what we'll do is I'll give some comments from our perspective. We'll have Atul give some comments from his and Ajay. It will be more of a conversation than a lecture at you. And we really encourage you to please do write in your questions on the BrightTalk platform. And we're happy to be able to answer those during this conversation as well. So Atul, maybe we'll start with you. As the General Manager of Digital Health at LG, your expertise spans various domains, and you spend a lot of time thinking about next-gen product design and development, and have been excellent at thinking about user experience. So now when we look at Gen AI-powered digital health platforms, how are you ensuring that we prioritize a patient-centric design as this process ensues? Maybe we'll start there, if that's okay, Atul.
Excellent. Thank you, Ami, for that wonderful question, insightful question. And thank you, Tata Elixir, for hosting this webinar. Very happy to be here. In relation to Gen AI and how that impacts how we are looking at designing new products and solutions for the patient and provider community, the basics still stay the same. So we have to understand the user's pain points, their needs, their context. And the user could be, like I said, a patient or provider or both. And we have to ensure that we are using using the product to solve a real problem that they're facing. As well as we have to always keep in mind that whether it's a legacy tool or a Gen AI related tool, it's just a tool. And by that, I mean, what we really have to do is make it simple for them to use. Because at the end of the day, both the patient and the provider, what they're really trying to solve is the health issue. So technology has to work in the back end. It has to help enable what both parties are trying to do and not be the centerpiece of the actual healthcare delivery piece. Now, in terms of the UX itself, UX is very critical because, like I said, this is just a tool. So user centricity is very important. We have to prioritize natural and intuitive design. We have to make sure that we are minimizing the cognitive load on the patient. And we are providing enough visual clues through the journey that it makes it very easy to follow along and to use the product that we are building. And lastly, I would say that we have to provide instructions or the how-to guides in a multimodal format, and particularly taking into consideration the cultural and language sensitivity when creating these support materials. So those are some of the initial thoughts that I have around designing new products using Gen AI.
I think that's a perfect kickoff to thinking about this, right? First of all, we're talking about a new tool. And even though there's great excitement at the end of the day, this is one more tool, and there will be even more newer, exciting ones that are coming as well. And so staying with this idea that we have to be centered around our user. Now, you talked a little bit about the cognitive load on patients, and I'd like to just speak from the clinician side for a minute, which is, if we think about practice, maybe 20, 30 years ago, as a cardiologist, I could probably find most of the information that I needed to care for a patient. I will tell you in practice today, and this is not limited to cardiology, that's just my experience, the amount of information available between the data that the actual patient generates, the data in their health records about their own past history, and then the copious information that is available about each of their diseases. And now remember, most adults in this world have several chronic diseases. They don't just carry one disease at a time. So knowing all that information, there's no way that a clinician today, the human brain, cannot possibly get all that information at the right time when they're seeing a patient within anywhere from 10 minutes to an hour to be able to provide the best care. And so I think this is where, for the clinician, it's equally important that there is a large cognitive load, and we know that we might fail at that we might miss something. So generative AI carries great promise for clinicians to feel that they can deliver the best outcomes. That's what we're concentrating on at the ACC, is how do we get the right information to the right clinician-patient combination at the point of care. One of the challenges in doing that, and I'm going to look at you, Ajay, for this, is how do we then think about scaling something like this? Because there are many smaller Gen AI companies who come to clinicians like us and say, hey, I can help take your information and I can do something with it. But that's one small company who has figured out how to create a large language model based on a set of PDFs, perhaps, right? A set of data that they put in. How do we now take larger amounts of data and develop a really tailored solution? I know at Tata, Alexi, that's something that you've been concentrating on.
Yeah. Thank you, Abby. Wonderful question. Pleasure sharing the panel with you and Atul today, and representing Tata Alexi. I represent a team of engineers. Being a passionate engineer myself, I have a ChatGPT login and then I do try out those innovative programs to see, okay, does it work? How does it make it better for a clinician or a provider or for a patient? So yes, true. There are too many solutions out there, too many white papers, and we see a lot of proof of concepts and pilots which are being out there. Now, as an innovation company, what we are doing is to carefully choose these innovations and navigate it for our customers to see how it is applicable to meet their goals. Now, there are several goals here. One is, of course, patient centricity, to make it easier and trustable solution for a patient, and it helps a patient to actually see technology as a companion through their journey. Or if it's for a provider who could make less error and more faster decision, like, hey, ChatGPT, could you pull up the patient medical history for me so that I have that ready on my screen right now and I can make a faster, better decision. Or it could be for a hospital to see how the patient retention can be maintained, and how the care continuum can be ensured, pre-hospitalization to post-hospitalization. So all these solutions are bucketed, and then we try to see how they can be actually meet the goals of each of these stakeholders. And plus, the critical other aspect is how it makes sure that it aligns to the regulatory compliances, and also the adaptation and integration with an existing system. I mean, we don't want to create a parallel system here. The scaling is more incremental, and it has to seamlessly be an extension of what is today currently.
I think that's exactly right. You mentioned regulatory. Atul, I'm going to look right back at you for a second here, and then I'll give my thoughts after. But the regulatory landscape is almost just being developed, right? We're working with the National Academy of Medicine at the ACC and others to start thinking about how are we going to ensure compliance? How are we going to ensure responsible AI? How are you thinking about that at LG in the digital health arm? Will you share a little bit about what your approach is?
Yeah, so traditionally, the regulatory frameworks basically are behind in terms of how fast the innovation is moving. So they always have to play catch up. And in this case, where AI is just exploding in every sector, especially in healthcare, the regulations aren't up to par, and they are evolving as we are understanding what the usage is of Gen AI and what the implications are to the healthcare stakeholders. The regulatory elements are being adjusted literally on the fly. So some of the ways we are looking to stay within the confines of the frameworks that have already existed and have served us well over the last several decades is understanding how, firstly, FDA regulates medical devices, including AI products. What is needed as an FDA clearance versus an FDA approval? Or what's a class 1 versus class 2? So we have a good understanding of that basic framework. On top of that, we layer on the idea of HIPAA applicability for patient data protection and privacy. So depending on the product we are building, we have to ensure that if appropriate levels of safeguards have been implemented to comply with the HIPAA guidelines. And lastly, in terms of just the pure healthcare regulations, we look at the HITECH Act, and depending on the need for the product to connect into the EHR or the electronic health records, it's important for us to make sure that it complies with that as well. Now, outside of the healthcare setting, LG is typically not known as a healthcare solution provider. We are more familiar with the consumer goods, appliances, entertainment, electronics, and so on. So we also follow what the National Institute of Science and Technology at the Commerce Department, the frameworks they have laid out in terms of cybersecurity or the AI risk management framework. So not only we look at the healthcare specific, but industry and in general, what the frameworks have been laid out, just to try to navigate our way through and make sure we are compliant with the current regulations. I hope that addresses the question.
No, this is perfect because I'm so glad you brought that up. We were at the Consumer Electronics Show earlier this year, and it was interesting to really see both the FDA be present and the FCC be present, to see the fact that we really need to think about what are the technologic guidelines we're following, what are the consumer guidelines we're following, and then what are the healthcare guidelines, right? And make sure that we are aligning with all of those. And that requires a different type of team that we put together. So I'm going to go back to where we started, which is for the Tata Group, for LG, for clinical cardiology, it used to be we all do one thing and we do that thing very well. We now have to create teams that have many different types of people. So I'm certain from the audience, for those who are listening, there are those who are wondering, is there a way that we can work with LG or work with Tata Elxsi? Hopefully also work with the American College of Cardiology. But as they're thinking about that, when you're building teams, when there are younger people who are listening, thinking, how do I approach this? What kind of people are you looking for right now? Where are the areas where you see a need for different types of experience to be together? Maybe let me start with you, Ajay, and then Atul to you.
Yeah, absolutely. This is exciting times. I mean, we see enormous amount of collaborations happening, and then people coming in together beyond medical devices and tech companies, and then hospitals and providers coming in. We're also seeing other industries now aligning with the healthcare needs and then enabling services. Just to quote an example, Tata Elxsi is today working with an operator in the Middle East, where actually they are setting the backbone network for actually enabling value-added services over their network for healthcare applications, mobile applications, which providers can subscribe and patients can subscribe. So it is definitely multi-party, and then it is collaboration. To add to Atul's point, I mean, he rightly pointed out, I mean, it has to be design specific. We need to make it more patient centric, and then patient empathizing the patient, the users, to see that it's not a learning exercise, but more of a convenience, and then it's absolutely seamlessly flows in. And then plus the data aspects will also need to be taken care. So typical teams, what we see here is designers and technologists working along together, and plus, the tech hyperscalers, I mean, including the latest technology enablers of cloud technologies, the IoT technology, the cybersecurity, data management, and plus the IT and system integration aspects of it all coming in together. So it's a team effort, and it cannot be pushed by one party into the market there. It has to be thought through from all aspects and all angles.
That's right.
And I
Atul,
think,
sorry, go ahead.
The same is true for us, because like Ajay is saying, one company cannot do it all. So LG is also engaging with different working groups, the regulatory groups, coalitions, to proactively discuss, understand, and help inform the regulations that are about to be put in place, regulatory requirements. So hopefully this would speed up both the creation of those regulatory frameworks, as well as avoiding any potential roadblocks that we and our coalition partners would face down the road if we were to build a product that does not comply with a certain guideline. So we always work with multi-party, multi-company groups, both private and public sector, just to understand and help inform the regulations of the future.
Absolutely. I second that. I mean, regulatory and the federal policies would become a key piece of this equation. Lab rats like us, I mean, we do a lot of tech innovation. We think that everything is possible, but then, I mean, what is actually practical there, and then how it can be controlled? I mean, ethical AI, and then also making sure that the patient data privacy is ensured. So those need to be defined, and we need help from the regulatory bodies. And then it is evolving. I mean, we see everyday updates, and the forums are actually discussing extensively to see how they can ensure ethical way of adopting these technologies. So regulatory and federal governments play a critical role in faster adoption of technology, and hence we it's a mandate for us. We stay abreast with them, and then keep updating our solutions for them.
I'm going to repeat that one time for our audience, right? So the regulatory and the government efforts are essential to our ability to scale and do it safely but quickly, right? Our underlying problem is access to care is abysmal globally. And so that is really what we're aiming at. Let's break down the things that you just mentioned. I'm going off script, so just go with me, Atul and Ajay. But thinking about a few different things. So let's start with FDA, right? Just on the US side. They have a program called the TAP program. It's a total product lifecycle program for breakthrough device that is digital health. They work with organizations like ours at the ACC, where if you're a cardiovascular digital health platform, they will send you to us so that we can help you think about what are the things you need to know, not right now for your technology. That's fine, the FDA will help you. But when you get into practice, what about the workflow? What about who's using your technology and how, right? That's where we come in. The part where we clinicians have a lot of difficulty, I'll mention that although we're called the American College of Cardiology, we have 57,000 members, 1/3 of whom are global, large presence in India, North Africa, Middle East, in Asia as well, and in Latin America. So that's why we're here. Sometimes the name American gets confusing. But as we think outside of the US as well, one of the key parts we find lacking as clinicians is infrastructure. And so in a way, you just started talking about this, Ajay, which is the infrastructure for being able to deliver digital health care at a reasonable, not even a large, right, at a reasonable way to the population. That infrastructure is very difficult to build through hospital systems. There are very large, there's Kaiser Permanente in the US, there's Apollo and other hospitals in India. But do we think that it's the hospital's responsibility to develop infrastructure? Do we think that it is large groups like Tata? Do we think it's a government responsibility? I'm asking more challenging questions, but I feel like our audience wants to hear some real answers, and you might be the right people to ask. So let me start with that in terms of responsibility for infrastructure. And Atul will kind of do you as well for that after Ajay.
Sure. Yeah, I think this is certainly the topic, critical aspect of this discussion. We need to understand the roles played by each of these parties, and community care, and then making sure that the healthcare access is enabled for the larger masses is a challenge today. We are keeping track of the doctor versus patient ratio globally, and then it is really bad. I mean, it's not proportionate. I mean, we see urban versus rural care, and hence, and we all strongly believe that technology is the solution here. But now, how to make it happen and how to make sure that the solution is actually taken and implemented is where we would need to work together with the government. And then the government programs also need to seamlessly adopt the latest technologies. I think that's where both the parties have their role to play. The technology providers like us need to create scalable technology where we are talking of patients in millions. That's how some of these programs need to be planned. And then the providers, hospitals, need to also collaborate and then make sure that they work in alignment with this scale. And plus, the government's infrastructure provided for actually operating and provide enabling services. So hence, it's extremely important. So we have seen. I think it's a good time that we have seen many governments adopting larger digital health programs. So even in countries like India, I think recently Tata Elxsi announced a program where Government of India is doing early detection of autism for kids, where a parent at home can actually do the assessment and then upload the observations onto a digital platform, and then it gets tracked as the child grows, and the clinical interventions can be provided as the child makes progress. So such initiatives are really welcoming. I mean, it is good to see that these are happening. I'm sure Amy, I have been following you, and I know your fantastic work you have been doing in the Southeast Asian countries, and maybe you could add to some of the programs which ACC is taking up, and then how it is contributing for the larger community healthcare.
Yeah, no, thank you. Thank you for the question back to me. I think for us, one of the most important mechanisms to work with other countries is to ensure that we don't say something like, we're going to come and fix things for you, right? It's a ground up effort, right? And I see the laughter over there. Atul's enjoying that. But it's true. That happens a lot, right? With nonprofit organizations, with people who really want to come help. But you realize that you have to work within the programs that exist, and you have to work from the people who are on the ground doing the work. Otherwise, both you can't scale, but you're also not probably sustainable. So in that mechanism, the way the ACC works is when we have our global partners and our global chapters, they're members of the ACC, but they're actually members of their own clinical organizations. They are in country. And we are not sending people from here to, be there. And I think that's why our global community has grown so much, because of the understanding that we can grow our efforts at cardiology. So let's just take the South Asian kind of subcontinent for a minute, right? We make up 25% of the world's population. We are responsible for 60% of the cardiovascular disease in the world. So if you talk about, where is there a discrepancy in the amount of disease versus the population, South Asians and cardiovascular health are at the top of that list. So the goals for us are to find local companies and partner with them. It's exactly what both of you said in terms of we can't do this alone. And so the technologies that exist in country are the ones that we want to get to know and we want to meet with. The ability outside of the United States, especially in India, but to be able, and it's actually in Africa as well, to be able to take the large middle class population and start to treat them not as consumers, but as self-advocates. The word consumerism at a point became something negative in healthcare. Oh, well, they're consumers of their own health. What are they really doing? Actually, it's not consumerism. It's patient advocacy. It's people saying, I care about my own health. I'm going to measure it. And that's where partnerships with us and you at Tata Elxsi or at LG to say, okay, then let's be consumer facing. Let's give you the best, most usable products, but let's ensure that they are filled with guidelines on cardiovascular disease. Let's ensure that there's education, not just for the patient, but for the patient in the language they understand, following adult learning. Sometimes it's visual, sometimes it's a short video, sometimes we use social media. How are you going to engage those patients to help them want to take better care of their health? So thank you for the question back, but I think those are the kind of relationships where when we meet companies who say, yes, we can empower the patient, but we understand the value of the back end of that empowerment being filled with real clinical detail and education for both the clinician and the patient. And then we need the back end of the infrastructure that you both can provide to then scale, because scaling from one clinician to the next, one doctor to the next, one at a time is going to be much too slow for us to be able to get there. I am looking at you smiling at much of this, thoughts from you about engaging the population, about scale. And then we'll move to maybe some stronger HIPAA questions next.
Absolutely. I think the fundamental piece around disparities in access to care for underrepresented populations, I think is a big issue across the globe, and including the US. We struggle with that issue here as well. And to your original point of infrastructure availability, and whether it's a technology infrastructure, access to internet or mobile services, that has reached a point where it's almost become a utility, like electricity or water or gas. So the question is interesting: who is supposed to build it? I think at this point it would require both a private and a public partnership to fill the gaps, because a large swath of the country or the globe has access, but then there are equally large swaths of areas that do not have access to basic infrastructure. So unless we are able to build or deploy those infrastructure elements in those areas, layering on healthcare services, whether they are Gen I or Gen AI related or traditional services, will be almost impossible. So first, once we get the tech infrastructure in place, then other pieces would flow naturally. And I really like the point that you made just a minute ago around multimodal content that is provided to patients so that they can understand and take care of their own health. And that's where I think Gen I can really help, where in real time it can do translations to the native language speakers in the language they are comfortable with, and be able to converse with the healthcare provider in that same language, so that both the patient and provider can have a much more meaningful discussion about how to manage their health, how to take care of themselves.
I think that's right. It's interesting as we talk about healthcare provision. This comment used to come a lot. Well, our clinicians, our doctors, going to be replaced by AI, and our very strong answer is no. That's not physically possible, right? The nuance, the edge, the context, the relationship between clinician and patient is so important. The one thing, this came up yesterday in a conversation, that probably is true is that the systems, the clinicians, the health systems, the public health groups who are able to utilize AI, specifically in this case, generative AI, are going to replace those systems which cannot. Because dealing with that large amount of data requires us to be able to vet that data, understand it, parse it, right? So find it, parse it, give it at the right time to the right people, and then allow the clinical understanding, the interaction between clinician and patient to happen on top of that. But all of that back end of getting that data is what Gen AI provides. Let me turn to HIPAA for just a second. Talking about privacy with Gen AI is very important. I smile a little bit because I just think about two daughters. They just turned 11 and 17. The older one especially, very facile on her phone, can do everything. But I think oftentimes just gives away her data every day to everyone. And I commented on this once, and she said back to me, well, Mom, you do too. I see you just say accept when you're giving things away. We see that in the health industry, right? People are using a variety of, and I won't name names, but wearables and other things or platforms, and they're happy to just give their information, not recognizing what they're given, in order to get some answers back. But when you then say we're going to do this at scale in delivering healthcare, then people become more concerned about privacy. I say that because I think it's a little bit funny that we give our data away so readily everywhere else. But when you say that, right, then all of a sudden, the reason I bring it up is the following. One is the Gen AI chatbots that are already out there answering health questions. They're not run by any of the three of us right now. They're run by institutions that don't have to follow privacy laws, that may not really have the patient outcome at the end of what they're doing, right? This is, how do we, as leaders in the field, start to address the fact that we're very interested in privacy, but also please be careful who you're giving your data to, because not everybody is paying attention like we are. I know it's not a question we planned for, but I'm curious as to both of your approaches to not just privacy at your own institution. We have faith that both of your groups will take this seriously, but how do we teach the public that you really need to follow people who are doing the right thing for you?
I think that's a great question, Nami, because there is so much fatigue and overload in terms of signing on the dotted line for a variety of terms and conditions and privacy policies, regardless of where you go, healthcare or otherwise. And it has come to a point where people just sign just to get the service that they're expecting without realizing what they're signing away. And therein lies the challenge. And including healthcare. I mean, if you look at the HIPAA forms, they are 4-page long and fine print, legalese all over. It's not created in a consumer-friendly format for somebody to easily understand what they're signing up for. Yet they sign every time they visit a physician or a clinic or a hospital. I think it'll require a tremendous amount of public service type educational efforts at the grassroots, as well as from the actors or the providers who are providing these services, to be able to explain what is being expected of the individual, what are we collecting, how are we going to use it, how are we going to secure it, and how can the patient, in this case, who is the ultimate owner of the data, has access to it and has all rights over it. That piece, I think, is missing at this point. The patient is typically not explained what they are signing up or signing off on. And that's a burden that lies on all entities, whether it's the care delivery, the care provider, or the enablers of the infrastructure. Everybody has to participate in that.
That sounds right. Ajay, from your perspective, especially when looking at the patients and starting to think, is there a way that we can be more user-friendly in explaining the hard things, explaining privacy?
Absolutely, I think it's a need of the hour. I mean, Atul did mention about the long forms, where we actually say try to get the patient consent, but then I mean I don't know, it's more inconvenient than actually trying to be more transparent with the patient. So technology can definitely play a role. While technology does the trick, it also brings in a conscious of social responsibility all of us hold, all the stakeholders hold. So we are I mean, playing with really. I mean, data is the currency now. Data is the heartbeat for the healthcare. So there is lot of data there, and some of those are really available at any point of time. I mean, storage and access is not a problem. So it's a social responsibility for the tech companies and the care enablers and care providers to make sure that we bring in 100% adherence to these regulatory norms, and then keep the patient privacy as our utmost priority. And while we do that, patient consent management is definitely can be improved. We can make it more interactive, simpler. Simpler is always tough. I mean, it's again, it's not giving an iPad and say that sign it digitally, but just also making sure that it is explained in a very simpler format for a patient to make sure that they know what they are getting into. The data management also has evolved. I think technology-wise, I think we see Gen AI is helping us to morph the data so that it automatically takes care of that data privacy, where we don't actually really need to get into the details, but we really extract what we need for an algorithm to learn, and so that we utilize that for our other applications and making it easy for the clinicians, providers, and for the patients. So technology is certainly helping, but I would say social responsibility need to be called out, and we all need to make sure that we adhere to it.
I like that you brought that up because as we're thinking of our last few kind of questions, and then we'll take some questions from the audience and answer those. Federated learning became so important during COVID, right? Being able to get information from massive numbers of countries, and video was one of the leaders at that point in doing that. But I know your groups also have thought very hard about how do we glean as much information we can from large swaths of data. And at the same time, all of our companies are thinking about how do we do that, but also personalize our approach to each individual. And once upon a time, we would have said those are at two different ends of the spectrum. And rather, I think that they require the same kind of infrastructure, right? Once we set up the same infrastructure for bringing data in, we can decide when does something just need to be general enough that we can get the right idea, the right approach, the right platform. When are we talking about something so specific, whether that's cancer, cardiovascular disease, other things, that we want to then layer on more personalized information in order to be able to then at that level extract the right plan for the right patient. And a similar infrastructure rather than dissimilar one is more likely to be the answer as we move forward. So with that in mind, that's one of my exciting thoughts about the future, right? With Gen AI and with large language models and data, really in addition to machine learning as well. In my brain, multimodality actually means getting the data, getting the images, getting the patient information, getting the social determinants, and putting them all together. From each of your perspectives, and maybe Atul, you can go first, and then Ajay, where do you see the exciting things happening? Maybe not in the next 6 months, but if we can manage to do Gen AI right, get the regulation, get the privacy, get the growth in the field, introduce RAG, be able to have context, what's coming next? So maybe either one of you, but maybe Atul first and then Ajay.
Sure, happy to. So I'll give you an example of what we are doing in the non-healthcare side of things, which is where LG typically operates. So we have roughly 7 to maybe 800 million appliances in the homes of consumers. And a vast majority of them have intelligent sensors put in there. So they keep track of how often a particular device appliance is being used, how many times, plus the condition of the device itself, the user behavior, and so on and so forth. All of that data are billions of data points we collect every day. So it's massive amounts of data. And what we do today with that data is improve the user experience of that particular appliance that the user is utilizing. And secondly, to alert the consumer that if a repair is needed on the appliance, that to alert them ahead of time and to offer them ways to solve it. So that's what we do today in the non-healthcare environment. But we are drawing parallels in what we can apply the same model in the healthcare setting, where we can, on the individual basis, collect all the different data points, whether they're coming from wearable sensors or what have you, or even just simple vitals and their blood work, for example. Map that all together against each patient, and then be able to provide very customized, purposeful, individualized, not care plan, but information back to them on how they can manage their health better. So that's what we are thinking about, how to move from a non-healthcare industry, bring the same models and concepts into healthcare and build on it. I'll say that we are in early days here. We are just scratching the surface with this on healthcare data, but it looks very promising. And probably in the next 3 to 5 years, you will see a lot more of this. I won't call it personalized medicine, but personalized care type approach based on individual data collection.
I can't smile any broader right now, so please excuse that. But this is exactly what we need, right? Because when we think about, if we go back to what I was talking about in the beginning, the majority of healthcare is chronic disease. Now, I'm not saying the majority of expensive healthcare is chronic disease. The acute disease is oftentimes most expensive, highest resource utilization. But the majority is chronic disease. And if you think of it as a pyramid, for those chronic disease patients, if we can have those individuals and those families be empowered, have the learning that they need, have the measurements in the home that they need, and be able to do what you do in other arenas, which is measure and feedback. You know, even those of us on this call right now, we don't all have the same blood pressure. Somewhere out there is a 4'11", very nice grandmother from India whose blood pressure is 80 at baseline. That is her, 80 over 50. And somebody will tell her 120 is not hypertensive, but in fact, she will have a stroke tomorrow. Because we can't just use numbers. We need to use ourselves as our baseline and then say, when are we out of our range? When are we in our range? And if we can do something about it in our own home, great. If we can't, that's when then the decreasing, sadly, number of providers or clinicians because of our workforce shortage can then say, okay, now it is my turn to intervene. I see this signal. You cannot do this in your community. You need me. And then I can gift you back to your baseline. Or if I need you to get that high resource care, I'm going to get you to the right place with the right care at the right time. And even though that is still resource and cost heavy, it is less so than you coming in with an emergent stroke because we didn't see this coming. And so your vision of the future really aligns with our clinical vision of the future, which is incredibly exciting. Ajay, from your perspective, looking forward, what do you see? Similar, different?
No, I can't agree more. I think you have rightly said. Atul has also rightly captured. Healthcare industry is learning from other industries in the AI adoption. But then, I mean, from the healthcare technologist point of view, I can say we are still dating with AI. I think we'll be married in next few years. So then we'll be happy. AI will be with us in all our workflows and all. I mean, it's kind of becomes a default. But then from purely some statistical or from what difference we may see, like 5 years when we have a similar session, and then when we say where we are, I think there could be few indicators. So one is I mean, I'll just pick top 3 indicators. One could be healthcare accessibility. We can put a benchmark where we are today in 2024, and in 5 years we definitely see that would increase. Reduction in medical errors. I mean, this is kind of a holistic tech adoption. It's not just for patient. It's for the clinicians. It's for the providers to see how well a medical error could be avoided and how technology is kind of bringing that error to minimal to zero. And the third indicator, what I see is we need to. I think we have started in the direction of predictive care. I mean, with advanced devices, I'm sure I've also been tracking LG's products too, where it is more of keeping track of patients' health and then personalized care, but then more of predictive care and how do we avoid. COVID happened. None of us thought COVID would happen 10 years ago. And we really need to prepare ourselves for something unknown, and then how technology can help us to act better, faster next time when something like that happens. So all these possibly could be indicators to claim, yes, AI did help us and we are different now what we were in 2024.
I love this. And this is why Tata Alexi is a leader in this field, because Ajay comes on and says, let me tell you, in 5 years, if we haven't done these 3 things, then maybe that's not progress. Let me pick up on number 2 for 1 second, medical errors. It goes back to the sheer amount of information that we have, but also how we used to do things. So we are the largest cardiovascular data registry in the world at the ACC. And we spend a lot of time where there are people who manually enter from this system. I will now type it into this system, right? And we're working towards the idea of how do we meet with healthcare technologists and companies who can help us extract the right data at the right time, because we know that the computer is less likely to make a mistake than we are. It still needs oversight, but less likely than the human. When we think about medical errors, there's 2 other ways to think about it too. In England, what we're actually seeing is that the British system is now starting to trial some systems to say, if you are going to prescribe these 2 medications, here is the error that I see happening, right, at a country level. And so I think those kind of things can be done right now. So whereas some of this is in the future, some of this we are really trying to do kind of globally right now. The third is not medical error, but it's about systems and workflow. Right now, if I am a cardiologist and I'm going to look at ultrasounds of the heart all day, I'm going to read the 6th one 6th, the 7th one 7th, the first one first. Whereas number 8, somebody is going to die soon. I don't know that because it just came in an order. So if the AI can be there and help me, not take my job, not take the place, but say, hey, based on what I know, and this is not generative AI, this is machine learning, but I'll just bring it up. I know that this pattern here is deadly. Let me make it number 2. When you are done reading number 1, number 2 will be the next most concerning, and the next most concerning, and so on and so forth. And by the time I get to number 22, we have helped significant numbers of people by getting to them earlier during the day. And this is in the hospital setting. But also by the time I'm tired, because that's when I'll make mistakes, is at the end of a day, sitting in a dark room, reading the same scans again and again. They will be easier scans. And I will feel better about myself, and the quality and the likelihood of error will likely be lower. So I think this even extends past generative AI, which is that AI in general is really going to help us be able to do a better job in delivering care. The phrase we use for it at the ACC is called collaborative intelligence, which is there's nothing artificial about it. We need to be responsible as health technologists at Tata Alexi, saying, this is our team. This is the kind of data that's going in. We know our data. We trust it. It's clean. We have control of it. Then when the data is actually being used, having groups like LG say, as we bring this data out, here's how we're going to share it. Here's how it fits in the ecosystem. Here's our role. And then clinicians being able to say, hey, here's how we need it. Can you adjust that? Because this is what the patient and the clinician needs. And so we refer to it as collaborative intelligence. And I feel like this webinar today is a great example of what collaborative intelligence can really look like. I think we are close to time. So maybe any final words from you, Atul, and then I'll give a couple words and then maybe over to Ajay last.
Yeah, no, thank you. It's an exciting area, the Gen AI and AI in general. And there's so much hype, I would say, around it at this point in time, which is not unnatural, because any new technology that comes out, we tend to overestimate its near-term impact and grossly underestimate its longer-term impact. And with Gen AI is following a similar track. And while everybody's super excited about what's going to happen this year and next, we are missing out on where this will take us in about 5 to 10 years. And I think that's what gets me most excited about, is what can this technology do for us in 5 years' time, in 10 years' time. It won't happen on its own. We'll have to put the right guardrails around it, have the right regulatory frameworks built around it, and make sure that it's accessible and available to underserved communities, because otherwise we'll keep building this chasm between the haves and the have-nots, and that is not going to benefit anyone. So we have to be very mindful of how we deploy this technology and who all has access to it.
I love that. I'll just add a word or two, especially when you talked about the haves or have-nots, which is my excitement for the future parallels yours, but is really for the idea that we used to say healthcare kind of belongs in the hands of doctors, and we now have more team-based care. But I think our ability to empower our patients and to really elevate the role of community health workers in whichever way we want to call them, right? But places in the community where people get healthcare. I think there's such an opportunity to no longer have a workforce shortage. If we rethink who the workforce is, we need things like generative AI to get the right information to those people to make our populations more healthy. And I think that's going to make a big difference. So we're really moving towards population health, but we're empowering everybody and no longer saying healthcare belongs only to the elite, only to the clinicians. It really belongs to everybody. And I think Gen AI may get us there. Ajay, let's turn to you, and Tata, Alexi, for our last words.
Absolutely. I mean, thanks. I think this discussion has been actually very kind of indicative of the fact that it should be collaborative. Future needs to be collaborative. Multi-parties need to come in together, and one stakeholder cannot actually do the magic. I mean, it has to be a team effort, and all of us have a role to play here. While technology is evolving faster than ever before, how much tech is too much? I mean, there's no answer to that. It has always been more and more tech adoption. But I think the stakeholders' viewpoints consideration is key here. And we all need to iteratively kind of help adoption of technology and then help each other and help all of our problem together. I mean, while we work together, we are solving for each of our problems too. So collaboration is the key here. I think we are heading in the right direction. Exciting times ahead.
Wonderful. Thank you. Well, I'm going to pass it back over to Divya. I'll just end by a challenge to the audience, which is the one most important part that moving forward, all three of us, I think is important, is our ability to measure our success. So when you are working in this field and you are thinking about AI in general or generative AI in healthcare specifically, how are you measuring success? And is it really the measurement that you want? Is it just engagement? Is it outcomes? Is it cost? But please start to measure that, report it, discuss it. Because if we don't do that, then in 5 years, we won't be able to tell Ajay, here's how we got better. Thank you so much. Divya, back over to you.
Great. So thank you, Ami, Atul, and Ajay for sharing your insights with us today. Thank you to our audience as well. It has been a pleasure to have you all join us. We hope you found this session both useful and insightful. And also, as mentioned, please feel free to submit any further questions you may have. We will get back to you with the Q&A report and the webinar recording link via email in a few days, allowing you to rewatch the session at your convenience. Also, I would like to use this forum to announce that we have launched a Tata Elixir AI compendium developed exclusively for the leaders. We are glad to share the link in the announcement window for your reference. Thank you once again.